So I got my more. It's for an Anthony Isigiri 11063, and an order is for NG tube, and then we'll connect it to a wall suction and then remove the suction and the NG tube. Patient is NPO and at bed rest. So, alright, I'll go inside. Knock knock.
Come in.
Hi, good afternoon. My name is Travice. I'm going to be your student nurse today, and we're pretty much going to be performing an NG tube placement for you. Do you know what that is?
No, sir.
Alright, anyway, we're just going to be placing a tube here. It's for your feeding, especially since you're nothing by mouth. Yep. Alright, so I'm just going to prepare the stuff. I have them with me here. And perform my hand hygiene. And before I further forget, can you verify for me your name and date of birth, please?
I think it's, let me look at the phone. David Schumer, 11063.
Alright, and check when you are who you say you are. So, Mr. Schumer, I'm just gonna prop your bed up and get you comfortable in a 90-degree angle, no, Fowler's position. And I'm gonna raise the bed. Alright, now that I've done that, perform hand hygiene. Mr. Schumer, I just wanted to ask, have you had any history or have you had any surgery done in your nose?
No.
No, alright. So I'm gonna get my light and check the nares for polyps. And nares looks clear. Now I'm gonna check for patency and have the patient breathe through each nostril to see which one I can put the tube in. So now I'm gonna measure. I'm gonna prepare my stuff. And put a towel for the patient. And I'm going to have a towel for the patient. And I'm going to prepare an emesis basin just in case he vomits. There you go, Mr. Schumer. I'll put this right there for you. So now we're going to be taking the NG tube and we're going to be measuring it to see what the appropriate length is. So it's from the tip of the nose to the earlobe, and from the earlobe to the tip of the xiphoid process. So that's approximately 45. Or we want to mark it down. Alright, 45. Just mark it down. 45. So we've checked the patient's nares and clear of polyps. So now we're gonna put lube on the NG tube before we insert it in the nostril. And you want it about 4 inches from the tip. We've done that. Now the patient is NPO, so we can't ask them to drink anything, but I will ask Mr. Schumer to, when I insert the tube, I'll tell him to swallow for me. I'm gonna have him hyperextend his head for me, and I'll be inserting it in the right or left, his left nares. Now he's gagged, so I'm gonna ask him to flex his neck down, and I'll be inserting it slowly. Alright. It's not gonna go all the way in, but so that's done. Now we're gonna get a tape. So we got the tape. And we're going to use it to hold it in place on his nose. Alright, are you comfortable, Mr. Schumer? Yes, I am.
Yeah.
Alright, so Mr. Schumer's comfortable. We're just going to have this place here so it doesn't get removed, alright? Alright. We're going to check for, what do you call this? Proper tube placement. And we can do either X-ray verification, have Mr. Schumer check for X-ray to see if it's in the proper location, or we can, using a stethoscope, inject 30 mLs of air here, and listen for his stomach while I'm injecting the air. If I hear a gushing of sound of air in his stomach and it's properly placed, or I could also aspirate gastric fluids or juices, take a sample, put it in a small container, take a pH strip, test it. If it's less than 5, then it's properly placed, because we want the pH level to be less than 5. Alright, so now we're going to connect it here. Now we're going to begin putting this in a suction. So for this, we want to connect one end to where it says patient. This end connects to the patient. And this end connects to the suction. Now for the suction, the order says between 80 to 120, so we're just going to turn it on, put it to intermittent, and put it on. That's now working. Alright, I'm going to turn it on, and we're going to lower it down. Just in between, so 100. And we're going to let it function for a while and wait till we remove it. So now we're going to remove it. First, what we want to do is turn this off and remove the tubing here. We want to disconnect it here. And take the gloves off. Perform clean hygiene. And we're going to don the gloves again. for time?
Yeah, 10. Yeah, 10 minutes.
All right. Alright, Mr. Schumer, so we're gonna be taking this off and we're gonna be checking because I had this I made a mistake. Well, when I'm taking the suction off, I'm gonna check this to make sure, flush this down to make sure all the juices are out so that I don't spill anything on the floor or in the bed. But again, now that it's removed, we're gonna roll this up, make sure that it's already clean. Alright, now I'm gonna ask Mr. Schumer to hold his breath for me. And when he holds his breath, we're gonna remove this slowly. And when he holds his breath, we're gonna remove it quickly. Alright. I did have the empty space in here just in case he vomited or secreted a liquid. Now I'm gonna ask him if he needs anything. Do you need anything else before I'm done? I can't offer you oral care, Mr. Schumer, because you are knocking by mouth. So when we do have it changed, then we'll be able to give you something for your to clean up. So aside from that, did you need anything else?
No, no.
Right now, so I'm gonna lower his bed back to a safe position. I'm gonna take the stuff out because these need to be properly disposed of. But just in general, this needs to be disposed of. I'm gonna take this off. We're gonna remove PPE. Clean hands. Make sure he's good. Provide call light if he needs anything. And then I'll be documenting. So the order was from NG Placement. Order from Dr. Kaufman for NG tube placement. With connection to pump, and then afterwards removal of NG tube from patient. Patient responded well. We're gonna document how the patient felt, how did they act towards the whole procedure. So for this case, patient responded well. Stated that there were no problems with their nose. With Naris. Patient responded well, responded to Naris. And I was write down what time it was performed, so performed by student nurse Travice, initial date 10/8/15 and time around 10:30 a.m. Alright, and that's it.
Okay. Are you finished?
Yep.
Okay.